Hello, everyone. My name is Sophia, and it is a pleasure to be speaking to you today, being beamed in from my kitchen, joining you all for the virtual Cholangiocarcinoma Foundation annual conference. We're going to be talking about our partnership and the Ciitizen platform, all the things that it can help you do today in your care, as well as all of the options you can unlock for the future. Ready to get started? So first, I want to take a second and celebrate 1 year of partnership. We launched together last summer, and since then, I've had the pleasure of working with so many of you and getting to know not only your story and your experience, but working together to make Ciitizen what it is today. We want to thank you from the bottom of our hearts for all of the feedback and the engagement you've given us, making sure that we continue to build this platform in a way that serves both you and your community. We are really excited to be launching 2 initiatives this summer together, all because of the success we've had over the last year and all of the people who've leaned in together with us. So thank you, really, from the bottom of every single one of our hearts, thank you. We're going to talk about 3 things. We're going to do a quick refresher on Ciitizen for those of you who may not have heard of our partnership before. Going to walk through how it works as well as how you can sign up in just a few minutes. Then we're going to talk about why you should join. There's a whole host of things that we are doing together that we want to make sure you're aware of and have the opportunity to ask questions about. And then the second 2, also known as 3, we're going to talk about how you can get involved, how you can connect with us, and what to do after this presentation. So let's talk about Ciitizen. What is it? There's a lot going on the slide, but if you go over here to the photo of Anil, our founder, and his little sister, Tanya, she died of metastatic breast cancer in 2017 and is really the muse of our company. Anil made a promise that he would kick cancer's butt. He uses stronger language than that. I'll let you use your imagination, but really that's why Ciitizen is here. We believe that change will be driven by the individual who is in control of their health data, and we have built this technology platform to do just that. So what do we do? We are a platform that helps you gather all of your comprehensive medical records, including clinical notes, genomic reports, imaging scans, not just your radiology reports, but the actual DICOM image files, the MRIs, the PET scans, CTs. And then we put it in a secure, safe place that's easy for you to access and give you the choice of sharing it with whomever you choose. And I want to emphasize that last point. As you just heard from Deven, we take privacy and your security incredibly seriously here. It is, you could say, the most important thing. And a big piece of that is you having the choice of controlling what happens to your medical data at all times. You could join Ciitizen, which is completely free of charge, and choose never to contribute your records to research, to the Cholangiocarcinoma Foundation, but just keep them for your own use. That is totally fine. That is your choice and your right, and we're here to give and enable that. But if you do choose to use your records and contribute them, we are here to create those compelling options for you. And we'll talk about 2 of those in just a second. But again, in summary, Ciitizen is just a 3-part tool. First, we gather all your records, and I really mean all of them. Next, we digitize them and make them accessible. I like to joke, if you've been on webinars with me in the past, that we've built Command Find in 2020. We have the ability to not only navigate our records, but view them in these interactive dashboards and timelines, search for a particular drug or date, all in the platform. On average, cholangiocarcinoma patients are seen at 5 different health systems. That's not just 5 different providers, it's 5 different hospitals entirely. And so, as you can imagine, that's a lot of medical records, thousands upon thousands of pages. And so we make it easy not just to have all of those in your control, but also to navigate them, because who's got time to look through 3,000 pages of medical records? My guess is you don't. So we're here to build technology that makes it easy for you to navigate all those records that are, again, in your control. Last, but certainly not least, we make it easy for you to share. We have the ability to build care teams. So you choose to add family members, caregivers, your physician, and they're all able to view your records, again, that you direct and consent to. Lastly, you have the ability to share different parts of your profile. So you can share the entirety, you can share just one record or one imaging file, your cancer card. So again, we're here to put you in a position of power to choose what happens to your medical data. Again, you don't have to share anything. We're here to create a tool for you to gather everything and then decide what to do with it. All righty. We're going to talk about quickly how it actually works. How do we do this? How do we turn thousands and thousands of pages into something that is easily searchable and something you can visualize in that interactive timeline, for example? So over here, number one, we collect your medical records under the HIPAA right of access. This is what Deven just spoke about at length. This is your legal right that she has fought hard to make sure you have, that we help you leverage in order to gather all your records. Next, we have fancy machine learning, natural language processing assisted extraction of those data elements. What that means is that we use computers to pull out all the relevant information from those thousands and thousands of pages. It goes through 2 levels of human review because you can never fully trust a computer. These are oncology nurses primarily who are reviewing your records and ensuring that the cancer summary or that profile that we share with you is indeed accurate. So last but not least, what you get is a data output that is structured, coded, queryable, and portable. Lots of big words to say. We make it useful to use your medical records for your own care or for other applications, including the fact that your records are now research ready. We'll talk a little bit more about kind of how you can use these ready to go records. But first, I want to walk through how easy it is to sign up. Because at the end of the day, we're here to make it easier for you to gather these records and to have them in your control. All right, so how do you sign up? If you visit ciitizen.com/CCF, and Ciitizen is spelled with 2 I's, and yes, that is on purpose, you'll see our website. You'll be able to read about our partnership, about a couple of the initiatives we have going, learn more about our company, how we keep your records safe and secure, as well as how to sign up. So go ahead. If you want, you can go to ciitizen.com/CCF on your mobile phone right now, and you can follow along with me. At the end of our presentation, we'll have a question and answer session that is live, and look forward to answering your questions then. You also can come and visit us at our live booth. Never had a virtual live booth before, so come check it out with us and meet members of the team. So everyone ready to get started? The only thing you need to have handy is your driver's license. And so whether you have that easily accessible now or something you can do later, let's go ahead and walk through how easy it is to sign up with Ciitizen. All right, visit ciitizen.com/CCF. And then you'll see a place for you to enter your mobile phone number. Enter in your mobile number and hit get started. We will immediately send you a text right to your phone. We'll tell you welcome and provide your unique access link. This link is unique to you and expires within 24 hours. So make sure that you go ahead and click that unique link to get started. Then right on your phone, you're going to get this next screen where we ask you, where have you received the majority of your care? Whether it's MD Anderson or Mayo Clinic, a local provider, an academic medical center, search for the place that you've received the majority of your care. While in this onboarding, we'll ask for just that primary facility. You should know that you have the ability to request as many records from as many institutions as you would like. Like I mentioned earlier, we know that existing cholangiocarcinoma patients on the platform have about 5 different providers, and we're here to make sure that we get all your records. Important to note, it's not just your oncology records. If you have an ophthalmologist, a cardiologist, a GI doctor, we really want to help you put all of your records, your single source of truth, in one place. It shouldn't just be a fragmented subset. So we're here to help you get all your records, and we really mean it. So once you go ahead and enter that facility, you're going to get a confirmation screen. If it is indeed the right place, hit continue. Next step, you're going to upload a photo of that driver's license I mentioned. We use this driver's license to request your records from your hospital. This is a requirement of them, similar to when you go into an appointment and they ask you to hand over your driver's license or a photo ID and your insurance card. It's the same use, just done digitally. We don't use your driver's license for anything else. Next, we'll ask you to sign your records release. This is the same as if you were filling out the form yourself, but again, we're here to make it easy and streamlined for you so that you're not chasing down forms, faxes, phone numbers, hold music, all of that good stuff we take care of for you. So once you have that driver's license uploaded, it just, when you hit that button, it turns on the camera of your phone. You just take a nice, clear, full picture, sign your record release, and hit continue. Next, you're going to create your Ciitizen account. So we're going to pull out a couple of pieces of information right from your driver's license, which is a pretty neat trick. Then we're going to ask about prior names. We're able to request all records under all legal names you've held, as well as what your diagnosis is. So if you start typing in cholangiocarcinoma, you're going to see both subtypes as well as cholangiocarcinoma in its entirety. Make the selection that makes sense for you, answer a few questions, and then enter your email and password, and you have officially signed up for Ciitizen. It's that easy. Look, when you're sick, when you're navigating appointments and what to do next and medications, and the last thing you should be doing is spending time on hold trying to get your medical records. That's what we're here for. We've built technology and streamlined processes to do this for you. Again, completely free of charge and always under your control. So before we move on, I'm going to show you what this looks like with my data. So if I made a request to MD Anderson, you're going to see what it looks like here. I'm going to have taken a photo of my driver's license, signed with my finger. Now, one quick note is that it's important that your signature, and I know it's really small, you're not going to be able to see it, matches your driver's license, because actually that's a form of two-factor authentication that we do, again, to make sure that you are the person that we are requesting records from. And so it's important that these match as closely as possible, and it's not a quick sign as if you were buying a coffee at the corner. The last step is about consent. Now, I mentioned earlier how your records are always in your control. This is step 1. We give you the choice of, when you sign up, choosing if you would like to consent your identifiable information for clinical trial opportunities is the first option, or if you would like to share your summary data with research. Now, what if you prefer to make your selection later? That is not a problem. What if you want to learn about research opportunities one by one? Not a problem. And you can always change your mind. We make it very easy for you to exercise your choice. And guess what? Part of having a choice is being able to change your mind. And so look through our consent. You're able to see, here the not so fine print. We're not hiding anything in legalese and in hidden links. We put it all up front here. Make the selection that you feel comfortable with just by hitting that toggle, no, yes, and then scrolling down and hitting continue. You'll notice that we don't default to anything. Ciitizen is opt-in as opposed to opt-out. When you sign up, you are not automatically sharing your data for anything. In fact, you have to take an active step to say yes. And we think that's really important because we want you to always be making a concrete and action-filled decision. Nothing should be by default. All right, so with that, we've wrapped up the sign-up process. Like I mentioned, if you have any questions, please stop by at our booth or reach out to us across the variety of different support channels we have that I'll list out at the end of this presentation. Next, we're going to talk about why you should join and a couple of the exciting initiatives that the Cholangiocarcinoma Foundation and Ciitizen have launched this summer. So first, what are some reasons to join? When you control your medical information, your records, when you have them at your fingertips, right on your iPhone, you have the ability to create options for yourself in your care, as well as for your community, should you choose to contribute those records for research. So have all your records securely at your fingertips. Then choose if you would like to participate in some of the initiatives that we are building and will build in the future. I'm going to spend a few minutes talking about two such initiatives and then wrap up here by overviewing kind of how you can get involved, how you can get in touch, and how we can make sure that you are set up with a citizen profile should you choose. All right. So a few weeks ago, I imagine many of you joined us for a webinar with Alexa Burke, our head of research and real world evidence, as well as Ellie Brimble, who leads our clinical operations team, where both of them spoke about what the Map It Forward and real world genomics study is. I encourage you to go back and listen and watch the recording if you want to learn more than just the few minutes I'll spend here, but we're really excited about the launch of this research opportunity, which is being done in partnership between the Cholangiocarcinoma Foundation and Ciitizen, where we are looking to understand how biomarker testing is being used. Biomarker testing is a really important part of understanding your disease and the options in your care. However, not everyone gets genomic testing, or they get it when they are metastatic and have progression. And so what we're asking is, under this, IRB-approved research study, what's going on? How is this being used? And once we understand and know those patterns out in the real world, we can devise interventions in education and awareness to make sure that every single patient is receiving this really important biomarker testing. So I'll give you a little teaser now. Please go read more about the research study and what we are looking to learn. Go watch that webinar from last month that Alexa and Ellie did and Melinda moderated to learn more. And really, really excited to be announcing today that Ciitizen is launching clinical trial reports with cholangiocarcinoma patients. We will be able to use all of the medical data in your citizen profile to automatically screen you for clinical trials that you may be eligible for. As many of you know, clinical trials are an incredibly strong treatment option, but not always the easiest to access. Clinicaltrials.gov isn't, let's say, the most user-friendly. It can be overwhelming. It's hard to navigate the exclusion and inclusion criteria, which is effectively that long list of things that says whether you are a good match or you aren't. So what Ciitizen has been able to do is take that, all of the medical data in your citizen profile and then match it against the protocols of all the open cholangiocarcinoma trials. We do that, and then we generate a report that looks something like this and allow you to have a conversation with your oncologist around what options might make sense for you. Again, the goal is to give you a tool to have a conversation in a more targeted way with trials that you are indeed eligible for. We have the ability to enter a location preference, especially in the time of COVID. Traveling isn't the most accessible. And so we help you kind of navigate your choices, all powered by the clinical and medical data in your citizen profile. We could not be more excited to be launching this within the cholangiocarcinoma community. This has been a many month effort in tight partnership with the entire CCF team, with Melinda, with Stacy, with Reham, and many others. And so we are really excited to be able to bring this to you all. How do you get one of these reports? So if you sign up during the conference, we will get your medical records in about a week or two, process all of them, and generate this report. We'll send you an email letting you know that your report is available and then for you to access it. Now, what if you're already a Ciitizen user? It's really important that your medical records are as up to date as possible so that that matching report is as accurate and reflective of your current status. And so for patients who already have existing accounts, make sure that you're going into your Ciitizen profile and re-requesting your records. We'll reach out to you every 3 months or so and ask if you'd like to refresh your records, but you can go in today, log in, and for any one of your previous requests, just hit the re-request button and we will be happy to get those latest records. All righty. So how do you get involved? Come talk to us at our booth. You can always reach out to us, and really we're here to listen, to be of service, and make sure that we are building a technology platform that helps you both in your care today and also allows you to contribute in ways that are consistent to what you would choose. So thank you. I want to invite everyone to ask their questions. Don't hold back. We'll be on for the next half hour, engaging in what I hope is a lively conversation. And then let's keep it going. Like I said, visit us on our booth, reach out to us. Many of you have met Mikkel, who heads our customer support team. You can email her directly. Here is her email. You can always chat with us by clicking this chat button on our platform, both on your mobile phone or on desktop. Call, text, we're here to chat. So thank you, everyone, and I look forward to your questions.
Hello, everybody. I'm Deven McGraw. I'm the Chief Regulatory Officer at Ciitizen, which is a company that's building a platform that will enable patients to have all of their health information at their fingertips. We have a terrific partnership with the Cholangiocarcinoma Foundation, but I want to first start out by talking about health information and why it's valuable and why it's so important for you to have all of yours so that if you need to seek treatment options, or if you want to donate your data for research, you have all of that information at your fingertips. So what do I mean when I say health data? Well, health data is really everything about you that's collected as part of your care. It's your medical records, it's your emergency room visit records if you have them, medications, genomics and genetic testing reports if you've had those done, imaging, lab results, surgical reports. Really, any record that is created as part of your care is information that is health data. And as I'll talk about in a minute, it's all information that you have the right to. You have a right to a copy. And why would it be important for you to have a copy? Well, what's the value of this data to you? Well, it is really the key to your care. You can use it to improve the coordination of your care. You can share it with a caregiver if they're helping to take care of you. You can use it for yourself. You can see if you match to clinical trials, for example. You can have a genetics report sent to a virtual tumor board registry in order to see if there's a precision medicine option that's available to you. And if you've got that information at your fingertips, you have the power to contribute it to research, to direct it to research, to make sure that research that you care about has your data. So that's really a lot of value. But there's no value in that data unless you have it. Now, don't get me wrong. When your clinicians have it, that's important too. But you are entitled under federal law, under HIPAA, to have a copy of all of this information. And this is, again, way more information than you probably see when you log on to portals in your doctor's office, where you might see some test results and you might see some medications, but it doesn't have the full complement of your healthcare. It probably doesn't have your images, It doesn't have genomic or genetic testing reports. And that's all information that you have a right to under HIPAA. It's called information in a designated record set. And I realize that's kind of a complicated term and you don't have to remember it. But what's important for you to remember is that your right to your information is very broad. It's much more information than, again, is affirmatively provided to you in portals. So this right has actually been around for a couple of decades, and yet it has been really hard for patients to exercise this right. They get told that they don't have the right to get their information. They get told that they can have their information, but only if they come in person to come and get it. Or they get told that they can have some parts of it, but not all of it, not images or not doctor's notes, because those belong to the doctors. And the reality is that there's just a lot of misinformation out there on the part of patients and frankly also on the part of healthcare providers about just how broad this federal right is for individuals to exercise. But part of the reason why Ciitizen was founded was to help patients get all of their information so that they don't have to do all of the work, that they don't have to go through the process of contacting every medical provider they've ever seen in order to get all of their records and to have them where they need them and at their fingertips. And that's something that we at Ciitizen do for our users. Okay, so let's talk a little bit more about the components of this HIPAA right to access your health information. So first of all, the process that each medical professional or hospital uses to gather requests from patients cannot be burdensome. And we do find that there are some entities that require people to come in person or require people to drop their requests in the mail, which creates a delay in receiving that request while it's in transit in the mail. And the process has to allow you to request access remotely and be something that is easy for you to do. Now, it is the case that they have to have a way to prove that you are who you say you are. After all, this request is coming in remotely. You're not standing in front of them. So the way that Ciitizen takes care of this is to get a copy of your driver's license and pass that along as we submit your request for records. And it's only for the purposes of identifying you and saying, it is this person's records. He or she has authorized Ciitizen to go get the records, and that's the only reason why we use it, and we store it very securely and don't use it for any other purpose. But it is important that the doctor or the hospital on the other end know that it's you who is making the request for privacy reasons. You also have the right to get your health information in the form and format and manner that you want it in. I call this the Burger King slide because it's that old Burger King commercial of have it your way. It's have it mostly your way, which means you get it in the form and format and in the way that you want it, as long as a hospital or doctor's office can produce it that way for you. This is really an issue of capability and not willingness. And so that means that if you want to get your information electronically, you have the right to get it electronically as long as it can be produced that way. You also have the right to have information sent to you by your personal email. If that's in fact more convenient for you, even though it might not be secure, you have the right to get it that way. The only way that they can say no to you is if you come to them and you say, hey, I have this thumb drive, and it would be great if you would just plug it into your systems and download a copy of my records onto it. Well, they don't have to do that because there might be viruses or malware on your thumb drive, and they don't want to introduce that into their systems. But otherwise, if you want to get it burned to a CD, if you want to get it by email, you have the right to get it that way. And this is an issue that is one of the primary reasons for noncompliance, and I'll talk in a minute about our scorecard. Timeliness and fees. You have the right to get this information within 30 days of requesting it. At Ciitizen, we actually get it in shorter amount of time. We average 14 days and sometimes more quickly. In many cases, that 14 days is our average. There is the possibility for limited fees to be charged for when you're getting a copy for your own use. But as long as those fees are calculated in a way that's compliant with HIPAA, which means most of the time they are very low, we pay those for our users. But in any case, if you're not using Ciitizen and you're being charged hundreds of dollars for your records, chances are that's a violation of HIPAA, where maybe the doctor's office doesn't understand that they can't charge you the full rate that they might charge like a lawyer or an insurance company. They have to give it to you for a much cheaper rate. So I want to talk a little bit about something that we have been doing in addition to, again, working with the Cholangiocarcinoma Foundation to make sure that their users can get all of their medical records and then be able to use them for treatment and for research purposes. We also figured out early on when we were trying to get records for so many of our users that we could probably make a difference in raising the bar for compliance with HIPAA, even for people that weren't using Ciitizen. So we created this scorecard, the patient record scorecard, which actually evaluates how well medical providers, and there are over 800 of them on the scorecard today, how they complied with a request by a patient for their medical information and to give them a score. And we have seen some rapid improvement actually in the industry in terms of how compliant entities are with the HIPAA right of access. When we first started doing this scorecard, we had non-compliance rates of over 50%. Our most recent version of the scorecard, which was published just a couple of months ago, that non-compliance rate was down to just over 25%. So we have really seen dramatic improvements in the compliance with the HIPAA right of access, which we're pretty excited about. So I just want to sum up here and say, we're really pleased to have a partnership with the Cholangiocarcinoma Foundation. We are excited about getting you all of your health information and putting the power of data in your hands. Here's just a little bit of feedback from some of our users, to be able to contribute your health data for research purposes from Melinda here at CCF. But also noting that you don't have to go get your information from all your portals because we do all that collation for you. And having your information can really be a matter of life and death for so many patients. So we're excited to be working with you all, and I hope you have a wonderful rest of your conference.